Hey, it's Dr. Allo once again. So people brought up a couple of questions about heart attack blood tests or heart attack tests, or how can you predict if someone's going to have a heart attack? So the number one things we use to predict if someone's going to have a heart attack is like your risk factors, your age, weight, sex, height, waist ratio, LDL cholesterol, hypertension, diabetes, obesity, all that kind of stuff. The more of those things you have, the more likely you are to have a heart attack or stroke within the next 5 years, 10 years, 20 years. There is a test to find out if you're actively having an acute MI. An acute MI is something we call a STEMI or a non-STEMI. It can be detected. The STEMI can be detected on an EKG, but the non-STEMI type of heart attack, you have a normal EKG, but your blood test is elevated. We call this test troponin. Troponin is probably the best advancement in medical care, and at least in cardiology, over in the last 20 or 30 years. We know with absolute certainty whether or not you're having a heart attack. It's called a troponin. You go to the ER, you say, ouch, I'm having chest pain. They do this test, and it shows us whether or not you're having a heart attack. There are other tests that we can do to test for stable chronic angina, where you have plugged up arteries. They're plugged up anywhere between like 50, 60%, 70%, 80, 90% or more, but you still haven't had an acute MI yet. Those would be things like stress tests or coronary CTs with a calcium score, or coronary angiography, CTA we call those. Those can tell us if you have plugged up arteries, but you haven't had an acute MI yet. Those predict whether or not you'll have chest pain when you exert yourself, when you walk, you get short of breath, you get chest pain. Those tests, the stress test and the CTA, are good at testing that. But an acute MI is tested with the EKG if it's an ST elevation MI, or with blood test for ST elevation MI and non-ST elevation MI. I hope that helps. Feel free to ask questions if you have any.